Sarah Johnson was excited to finally get her appendix out. The sharp pain that had sent her to the emergency room at 3 in the morning had been almost unbearable. But now the worst was behind her. At 12 years old, this was her first surgery, and despite being scared, she had been brave throughout the whole ordeal. The operating room had been cold and bright, filled with masked faces and beeping machines. But the doctors and nurses had been kind, explaining everything they were doing in simple terms that helped calm her nerves. The anesthesiologist had made her laugh right before she drifted off to sleep, telling her to dream about her favorite ice cream flavors. When Sarah woke up in the recovery room, her side ached but not with the same intense pain as before. A different kind of discomfort had replaced it, a dull throbbing that the recovery nurse assured her was normal. Her parents, Michael and Lisa Johnson, were both there when she first opened her eyes, their faces showing that mixture of worry and relief that parents get when their child has been through something scary, but is now okay. "You did great, sweetie," her mom said, squeezing her hand gently. "The doctor said everything went perfectly." Sarah tried to smile, but her mouth was dry. Her dad immediately noticed and held a small cup of water with a straw to her lips. That was just like him, always noticing the little things that needed fixing. "Small sips," he reminded her. As a cardiothoracic surgeon himself, her dad couldn't help but slip into doctor mode, even with his own daughter. The recovery room was busy that day, with nurses moving efficiently between patients. Sarah dozed on and off as the anesthesia continued to wear off. Her mom kept checking the time, looking increasingly anxious. "I hate to do this," Lisa finally said, "but I need to pick up the twins from school. Your grandmother was only available to watch them for the morning." Sarah's younger brothers, 6-year-old twins, were a handful on the best of days. She understood why her mom needed to go. "It's okay, Mom, Dad's here," Sarah said, her voice still raspy. Her father checked his watch. "Actually, I have an emergency surgery scheduled in an hour at University Medical. I can't miss it. It's a valve replacement for a patient who's been waiting months." He looked genuinely torn. "But I'll come right back after. You'll be settled in your room by then, and I'll bring your favorite books and that rainbow blanket from home." "I'll be fine," Sarah assured them, trying to sound more grown-up than she felt. In truth, hospitals made her nervous. All the strange smells and sounds, people rushing around in scrubs and white coats. But she didn't want her parents to worry more than they already were. A hospital administrator came by with transfer paperwork. She'll be moved to the pediatric floor soon. Nurse Winters will be her primary care nurse for the evening shift. Her parents spoke with the administrator about visiting hours and care instructions while Sarah drifted in and out of sleep. Before her mom left, she kissed Sarah's forehead and promised to call and check on her throughout the evening. Her dad did the same, explaining he would be back around 7 after his surgery. "Dr. Johnson," the administrator said, recognizing the name. "From University Medical? I believe some of our staff know you from the regional medical conferences." Her father nodded. "That's right. I'll be back this evening, but please make sure the nursing staff has my direct number if anything comes up with Sarah." As her parents left, Sarah felt a twinge of anxiety. This was her first time staying in a hospital alone, even if it would just be for a few hours. The recovery nurse patted her shoulder reassuringly. "Don't worry, honey. We'll take good care of you until your parents come back." Sarah was transferred to the pediatric ward about an hour later. The room was nicer than she expected, painted in cheerful colors with cartoon characters on the walls. There was even a small TV mounted across from her bed. The transport team was friendly, joking with her as they moved her from the stretcher to the hospital bed, being careful of her IV line and the surgical site on her abdomen. "There you go," said one of the transporters. "All set. Your nurse should be in shortly to get you settled. Her name is Diane Winters. She's been here forever, knows everything about everything." Sarah thanked them and tried to get comfortable. The pain was starting to come back as the stronger medications from surgery wore off. She hoped the nurse would come soon. Staring at the ceiling, she counted the tiles to distract herself from the discomfort, wondering what her dad was doing. Was he in surgery yet? Was he saving someone's life right this minute? From the hallway, Sarah could hear the busy sounds of the pediatric floor. Phones ringing, nurses chatting, the occasional cry of a younger child. Through her partially open door, she saw staff members walking briskly past. Several nurses stopped at the room next to hers, cooing and making friendly conversation with what sounded like a much younger patient. Nearly 30 minutes passed before a nurse finally entered her room. The woman was middle-aged with graying blonde hair pulled back in a tight bun. Her scrubs were immaculately pressed and she wore a name tag that read, Diane Winters, RN. Sarah Johnson? The nurse asked, barely glancing at her as she checked the chart and the patient ID bracelet on Sarah's wrist. Yes, that's me, Sarah answered politely. Nurse Winters nodded curtly and began checking the IV and monitors without saying anything else. Her touch wasn't exactly rough, but it wasn't gentle either. There was none of the warmth Sarah had experienced from the other hospital staff. The pain is getting worse, Sarah said hesitantly. The doctor in recovery said I should let someone know when that happens. Nurse Winters looked at her watch. You're not due for more pain medication for another hour. Her voice was flat, dismissive. But it really hurts, Sarah persisted, tears forming in her eyes despite her best efforts to be brave. The nurse sighed. On a scale of 1 to 10? Maybe a 7? Or 8 when I move. I doubt that, Nurse Winters said under her breath, but loud enough for Sarah to hear. You people always exaggerate. Let's call it a 5 and see how you do in an hour. Sarah was confused and hurt by the comment. What did the nurse mean by you people? And why didn't she believe her about the pain? Sarah had never met this woman before. I'm not making it up, she said quietly, a tear slipping down her cheek. Listen, Nurse Winters said, her voice lowered. I've been doing this job for 20 years. I know when someone's trying to get extra medication. Just try to rest and stop focusing so much on every little discomfort. Sarah was shocked into silence. She had never been accused of lying before, especially about something like this. As the nurse left without another word, Sarah felt utterly alone and increasingly uncomfortable. The pain was definitely getting worse, and now she was afraid to ask for help again. In the next hour, Sarah watched as Nurse Winters came and went from the room next door several times, her voice noticeably warmer and more attentive with the other patient. When Sarah pressed her call button because she felt nauseated, it took nearly 20 minutes for anyone to respond. And it wasn't Nurse Winters who came, but a nursing assistant who apologized for the delay. Nurse Winters asked me to check on you, the young assistant said. She's busy with another patient. I feel sick to my stomach, Sarah explained. I'll let her know. She'll need to check if you can have any anti-nausea medication. Another 15 minutes passed before Nurse Winters returned, looking annoyed. Now what's the problem? I feel like I might throw up, Sarah said weakly. The nurse placed a small kidney-shaped basin on the bedside table. Use this if you need to. It's probably just from the anesthesia. It'll pass. Could I have some water, please? Sarah asked, her mouth dry from anxiety and medication. I'll send someone when they're free, Nurse Winters replied, already heading for the door. You're not the only patient on this floor. Sarah reached for her phone on the bedside table, wincing as the movement pulled at her incision. She needed to text her dad. Something wasn't right about the way this nurse was treating her, and she didn't know what to do. The afternoon dragged on painfully for Sarah. Her text to her father had been brief. Dad, I don't feel good. The nurse isn't being nice. Can you come sooner? She wasn't sure if he would see it right away since he was probably in surgery, but just sending the message made her feel a little less alone. The hospital room felt colder now, despite the cheerful decorations. Outside her window, the sun was beginning to sink lower, casting long shadows across the walls. Sarah tried to distract herself by watching TV, but couldn't focus on anything with the growing discomfort in her abdomen. She'd never felt so helpless before. 2 hours had passed since Nurse Winters had last checked on her. The promised water never came, and Sarah was too afraid to press the call button again. She could hear the nurse's voice in the hallway, laughing and chatting with other staff members. It sounded like a completely different person from the cold woman who had dismissed her pain. A younger nurse poked her head into the room. Hi there, I'm Lucia. I'm helping Nurse Winters with her patients today. How are you feeling? Her smile was warm, her dark eyes kind. Not good, Sarah admitted, relieved to see a friendly face. My stomach really hurts and I'm so thirsty. Lucia frowned and checked Sarah's chart. You haven't had pain medication since you arrived on the floor? That's no. Right, she looked at her watch. You should have had a dose over an hour ago. She said I wasn't due yet, Sarah explained quietly, and that I was exaggerating about how much it hurt. Something flashed across Lucia's face, concern mixed with recognition. She immediately poured a cup of water from the pitcher that had been sitting just out of Sarah's reach on the far side of the bedside table. Small sips. Lucia instructed gently as she held the cup to Sarah's lips. I'm going to check on your medication right away. As Lucia turned to leave, Nurse Winters appeared in the doorway. Her expression hardened when she saw Lucia helping Sarah. I've got this, Lucia, she said stiffly. You're needed in room 412. But her pain medication, Lucia began. I said I've got it. Nurse Winters cut her off. I was just about to take care of it. Lucia hesitated, looking from Nurse Winters to Sarah. Okay, she finally said. I'll check back later. The look she gave Sarah seemed to say, hang in there. Once Lucia left, Nurse Winters approached the bed. Creating problems already, are we? She asked Sarah, her voice low and unfriendly. I'm just in pain, Sarah said, trying to keep her voice steady. The other nurse said I should have had medicine an hour ago. Well, Lucia hasn't been a nurse for 20 years like I have, Nurse Winters replied. She doesn't understand that building pain tolerance is important. You can't just run to medication for every little twinge. Sarah couldn't believe what she was hearing. This wasn't about toughness, she'd just had surgery. Even with her limited knowledge as a 12-year-old, she knew patients were supposed to receive pain medication on schedule after operations. My dad says pain control is important for healing, Sarah said, remembering conversations she'd overheard at home. Her father often talked about patient care with her mother over dinner. Something changed in Nurse Winters' expression. Your dad, and what would he know about it? He's a doctor, Sarah explained. A heart surgeon at University Medical. For a moment, Nurse Winters seemed taken aback, but she quickly recovered. Well, he's not your doctor here, is he? I'm following the orders we have. She checked Sarah's IV line roughly. I'll get your medication now since you've made such a fuss about it. She returned a few minutes later with a syringe, which she injected into Sarah's IV line without a word. The medication would take time to work, but just knowing relief was coming made Sarah feel slightly better. Thank you, Sarah said politely, despite everything. Nurse Winters didn't acknowledge the thanks. Instead, she made a quick note in the chart and said, I'll be back to check your vitals in a while. Don't bother the other nurses unless it's an actual emergency. After she left, Sarah noticed her phone lighting up with a text. It was from her mother asking how she was doing. Sarah didn't want to worry her mom, who was already stressed with taking care of the twins alone. But she also couldn't pretend everything was fine. Okay, but hurting, she texted back. Miss you, when is Dad coming? Her mother's reply came quickly. He should be done with surgery soon. Hang in there, sweetie. Love you so much. Sarah closed her eyes, willing the medication to work faster. The throbbing in her side had become a constant companion, sometimes fading to background noise, other times demanding all of her attention. She must have dozed off briefly because she woke to the sound of a food tray being placed on her table. A different hospital worker, an older man with kind eyes, had brought dinner. Not sure if you're up for eating yet, but it's here if you want it, he said. Jell-O is usually a good place to start after surgery. Sarah thanked him, even though the thought of food made her stomach turn. The man noticed her discomfort. Not feeling too good, huh? He asked sympathetically. Sarah shook her head. Want me to find your nurse? No, thank you, Sarah said quickly. She's busy. The man gave her an understanding look. All right then, but use your call button if you need anything. That's what we're here for. As the dinner hour passed, Sarah noticed increased activity in the hallway. Nurse Winters seemed to be everywhere except her room, checking frequently on other patients, her voice noticeably warmer with them. The one time she did come in, it was only to take Sarah's temperature and blood pressure, noting them in the chart without comment. I think I have a fever, Sarah said, feeling the clamminess of her skin. And my incision feels funny, kind of hot. Your temperature is only slightly elevated, Nurse Winters replied dismissively. That's normal after surgery. Stop looking for problems, but listen, Nurse Winters interrupted, leaning closer and lowering her voice. I've been dealing with your type for years, always wanting special treatment, always claiming something's wrong. In my experience, you people just have lower pain thresholds and higher complaint levels. So unless you're actually dying, stop buzzing for attention every 5 minutes. Sarah was stunned into silence. Your type, you people? What did that even mean? She'd never met this woman before today. How could she have any type at all other than being a kid who just had surgery? As Nurse Winters turned to leave, Lucia appeared at the door again. "Everything okay in here?" she asked, her eyes taking in Sarah's pale face and the untouched dinner tray. "Perfectly fine," Nurse Winters answered before Sarah could speak. "Just a bit of post-op discomfort, nothing unusual." She gave Lucia a look that clearly said, "Move along." But Lucia didn't move. "I'd like to check the incision site," she said. "Protocol for pediatric post-ops." Nurse Winters seemed about to object, but instead shrugged. "Be my guest." "You'll see, it's fine." Lucia waited until Nurse Winters left before approaching Sarah's bed. "Let's have a look," she said gently. "I'm going to lift your gown just a bit to see the bandage, okay?" Sarah nodded, grateful for Lucia's kindness. The younger nurse carefully pulled back the covers and lifted the hospital gown to examine the surgical site. Her expression changed immediately. "This is red and warm to the touch," she said, her voice professional but concerned. "And the bandage needs changing. Has anyone looked at this since you came up from recovery?" Sarah shook her head. "Don't, Nurse Winters just checked my vitals." Lucia pressed her lips together, clearly troubled. "I'm going to get some supplies to change this dressing, and I think we should get the resident to take a look." "Is something wrong?" Sarah asked, fear creeping into her voice. Lucia gave her a reassuring smile. "It might just be a normal post-operative reaction, but it's better to check. Your comfort and safety are the priority." She squeezed Sarah's hand. "I'll be right back." As Lucia left, Sarah heard raised voices in the hallway. She couldn't make out the words, but she recognized Nurse Winters' sharp tone. A few minutes later, Lucia returned with a tray of supplies, followed by a young doctor in a white coat. "Hi, Sarah. I'm Dr. Patel, the pediatric resident on call." The doctor introduced himself. "Nurse Lucia tells me you're having some discomfort at your incision site. Mind if I take a look?" Before Sarah could answer, Nurse Winters appeared in the doorway, her face tight with anger. "I already checked her." "This is unnecessary." Dr. Patel looked surprised. "It's standard procedure to examine any potential signs of infection, Nurse Winters. And it's a waste of your time," she insisted. "The girl is fine, just dramatic. I have 20 years of experience, nevertheless." Dr. Patel cut in firmly. "I'm going to examine my patient." Nurse Winters stood there for a moment, then turned and walked away without another word. Dr. Patel and Lucia exchanged glances before returning their attention to Sarah. "Now, let's see what's going on here," Dr. Patel said kindly. As they examined her incision, Sarah heard her phone buzz again. It was another text from her dad. "Just finished surgery. On my way to you. Be there in 20 minutes. Hang on, sweetheart." For the first time since her parents had left, Sarah felt tears of relief forming in her eyes. Help was coming. Dr. Patel's gentle hands examined the area around Sarah's incision with careful attention. His brow furrowed slightly as he pressed various spots near the surgical site, asking each time if it hurt. "Yes?" Sarah winced when he touched a particularly tender area. "That really hurts." "I can see why," Dr. Patel said, his voice calm but concerned. "There's definitely more inflammation here than I'd expect at this stage. Your temperature is 100.8, which is borderline for post-surgical fever." He turned to Lucia. "Let's change this dressing and get a culture to be safe, and I want her pain medication schedule reviewed immediately." Lucia nodded, already opening sterile packages of gauze and antiseptic solution. "I checked her chart. She should have received pain medication twice since arriving on the floor, but there's only one administration documented." Dr. Patel frowned. "That's not acceptable. Please update her orders to include regular monitoring of the surgical site and temperature checks every 2 hours." He looked back at Sarah. "We're going to take good care of you, okay? This might be nothing serious, but we want to make sure." The kindness in his voice made Sarah's eyes well up again. After hours of feeling dismissed and alone, having someone take her concerns seriously was overwhelming. "Thank you," she whispered. "Your dad is a doctor, right?" Dr. Patel asked as Lucia began cleaning around the incision. "Yes, he does heart surgery at University Medical," Sarah replied. "I thought I recognized the name," Dr. Patel said with a small smile. "I attended one of his lectures during my med school rotation. He's very respected." This didn't surprise Sarah. Her father was often invited to speak at medical conferences and teaching hospitals. He was known for both his surgical skill and his compassionate approach to patient care. "He's on his way here now," Sarah said, feeling a surge of relief at the thought. "Good. We'll get you more comfortable before he arrives, Dr. Patel promised. Lucia is going to change your dressing, and I've ordered some additional pain medication that should help you feel better soon. As the doctor left, Lucia worked efficiently to remove the old bandage and clean the incision. This might sting a little, she warned before applying the antiseptic. Sarah bit her lip but stayed brave through the procedure. When Lucia was finished applying the fresh bandage, she adjusted Sarah's pillows and helped her find a more comfortable position. Better? Lucia asked. A little, Sarah admitted. The new position did help, but the pain and discomfort were still very present. I'll be right back with your medication, Lucia promised, and maybe we can find something more appealing than hospital jello for you to try eating. You need nutrition to heal. While Lucia was gone, Sarah heard a commotion in the hallway. She recognized Nurse Winter's voice, raised and defensive. I've been doing this job for 2 decades, she was saying loudly. Don't tell me how to manage my patients. It's not about experience, a male voice responded, Dr. Patel. It's about following proper protocols for post-surgical pediatric care. Those protocols are just guidelines, Nurse Winters argued. And some patients don't need coddling. They need to learn to tolerate discomfort without immediately reaching for drugs. That is not your decision to make. Dr. Patel's voice was firm. Pain management is medically necessary for proper healing, especially in children. Their voices moved further away down the hall, but Sarah had heard enough to understand that Dr. Patel was standing up for her, and possibly other patients too. The knowledge that someone was on her side made the room feel less cold and frightening. A few minutes later, Lucia returned with another nurse, a middle-aged woman with a warm smile. Sarah, this is Melody, the charge nurse for this evening, Lucia introduced them. She's going to help me get you settled more comfortably. Melody approached the bed. I understand you've had a rough afternoon, she said kindly. I'm sorry about that. We're going to make sure things go better from here on out. Sarah nodded, too exhausted to speak much. Melody checked her IV line and then administered medication through it. This should start helping with the pain in about 15 minutes, she explained. And we've brought you some apple juice and plain crackers to try. Sometimes starting with something simple is better after surgery. The 2 nurses worked together to straighten Sarah's sheets and adjust her bed. Melody also brought a fresh gown since the current one had become slightly damp with sweat from the low-grade fever. Would you like to try changing into this? We can help you, Melody offered. Yes, please, Sarah said. Her current gown felt uncomfortable against her clammy skin. With the nurse's gentle assistance, Sarah managed to change into the fresh gown without putting too much strain on her incision. The cool, clean fabric felt wonderful against her skin. That's better, Melody said with satisfaction. Now, is there anything else we can do to make you more comfortable while we wait for your dad to arrive? Could I have my phone closer? Sarah asked, pointing to where it lay just out of comfortable reach. And maybe the TV remote? Absolutely. Lucia handed both items to Sarah. Small things make a big difference when you're not feeling well. As the nurses finished their tasks, Sarah heard a familiar voice in the hallway, her father's deep, authoritative tone asking for her room number. The sound sent a wave of relief through her entire body. Her dad appeared in the doorway, still wearing green surgical scrubs under his white coat, his hospital ID badge from University Medical hanging around his neck. His face, usually composed and professional, showed immediate concern when he saw her. Sarah, he said, quickly crossing to her bedside. I got your text. What's going on, sweetheart? Before Sarah could answer, Nurse Winters appeared behind him in the doorway, her expression suddenly transformed. The coldness had vanished, replaced by an artificially pleasant smile. Dr. Johnson, I presume? She said, stepping forward with an extended hand. I'm Diane Winters, your daughter's primary nurse for the evening shift. Sarah's father glanced at the nurse but turned back to his daughter without shaking the offered hand. Sarah, he prompted gently. Tears welled up in Sarah's eyes as the stress of the afternoon caught up with her. She wouldn't give me my medicine, Dad, she said quietly. She said I was exaggerating about how much it hurt, and she wouldn't bring me water when I asked. Michael Johnson's expression hardened as he turned to face Nurse Winters. The nurse's smile faltered. Children often misinterpret it, she began. I'd like to see my daughter's chart. Please, he interrupted, his voice professionally calm but with an unmistakable edge of authority. Nurse Winters hesitated. Melody, who had been observing the interaction, stepped forward. I'll get that for you right away, Dr. Johnson. she said, giving Nurse Winters a pointed look. As Melody left to retrieve the chart, Michael turned his attention back to Sarah, gently placing a hand on her forehead. "You're warm," he observed, his doctor's instincts immediately assessing her condition. "Has your temperature been taken recently?" Dr. Patel checked it a little while ago, Lucia offered from where she stood adjusting the IV drip. It was 100.8. He ordered more frequent monitoring and has concerns about inflammation at the incision site. Michael nodded his thanks to Lucia before carefully folding back Sarah's blanket. "May I see, honey?" he asked his daughter. Sarah nodded. Her father gently lifted the edge of her gown just enough to see the bandaged area. His trained eyes took in the redness visible around the edges of the dressing. "When was her last dose of pain medication?" he asked, not looking up from examining the surgical site. "About 10 minutes ago, sir," Lucia answered promptly. Dr. Patel ordered it when he found she had missed her scheduled dose. Michael's jaw tightened. He turned to look directly at Nurse Winters, who stood uncomfortably by the door. "Missed her scheduled dose?" he repeated quietly. "I was attending to multiple critical patients," Nurse Winters said defensively, "and in my professional judgment, she seemed to be managing her discomfort adequately. Is that so?" Michael's voice remained measured, but there was no mistaking the controlled anger beneath the surface. "And what metric did you use to determine that my 12-year-old daughter, fresh out of surgery, was managing her discomfort adequately despite her stating otherwise?" Before Nurse Winters could respond, a young hospital worker paused in the doorway. He was pushing a supply cart and had clearly overheard part of the conversation. "Excuse me," he said hesitantly. "I don't want to interrupt, but I think there's something you should know." "Doctor," all eyes turned to the young man, Thomas. "This is a private discussion," Nurse Winters said sharply. Thomas straightened his shoulders, looking nervous but determined. "I was restocking supplies in the medication room earlier, when Nurse Winters was talking to another nurse. I heard her say—" He paused, clearly uncomfortable. "Go on," Michael encouraged. "She said she was tired of certain patients always claiming they needed special treatment. She specifically mentioned the black girl in 415 and said some really inappropriate things about pain tolerance and other stuff I don't want to repeat." The room fell silent. Sarah looked confused, not fully understanding the implications but sensing the sudden tension. Michael's expression had gone completely still, a controlled calm that anyone who knew him would recognize as his most dangerous mood. "Thomas, thank you for speaking up," he said evenly. "That was brave and the right thing to do." Nurse Winters' face had drained of color. "He's lying. I'd like to speak with the hospital administrator." Michael cut her off, his voice leaving no room for argument. "Immediately." Melody had returned with the chart and had heard Thomas's statement. "I'll page Dr. Hartman right away," she said, her expression grave. As Melody stepped out to make the call, Michael turned his complete attention back to Sarah, his voice softening. "How are you feeling now, sweetheart? Is the medicine helping at all?" Sarah nodded slightly. "A little. It's starting to hurt less." "Good." He smoothed her hair back from her forehead. "I'm here now and I'm not going anywhere." From the hallway they could hear Nurse Winters' raised voice as she followed Melody. "This is ridiculous. That boy is making things up. I have an impeccable record." Sarah looked up at her father, confusion in her eyes. "Dad, why was she so mean to me? What did I do wrong?" Michael's heart broke at the question. He took his daughter's hand in his thumb gently stroking her knuckles. "You did absolutely nothing wrong, Sarah," he said firmly. "Nothing at all. This isn't about you, it's about her and her prejudices. And it's completely unacceptable." He glanced at Lucia, who had been quietly adjusting Sarah's IV. "Would you mind staying with Sarah for a moment? I need to make sure this situation is addressed properly." "Of course, Dr. Johnson," Lucia agreed. "We'll take good care of her." Michael leaned down to kiss his daughter's forehead. "I'll be right back, sweetheart. And then we're going to make sure you get the care you deserve." Michael Johnson stepped into the hallway, his mind racing with both parental concern and professional indignation. The hospital corridor buzzed with the usual evening activity, staff changing shifts, medicine carts being wheeled from room to room, the distant sound of a television from another patient's room. But Michael barely noticed any of it. His focus had narrowed to a singular purpose: ensuring his daughter received proper care and addressing what appeared to be discrimination. He spotted Dr. Hartman, the hospital administrator, hurrying down the hall toward him. A tall woman with silver-streaked hair pulled back in a neat bun. She had the harried look of someone whose evening had just become unexpectedly complicated. "Dr. Johnson," she said, extending her hand. "I'm Dr. Patricia Hartman, Chief Medical Officer. I was told there's a situation involving your daughter's care." Michael shook her hand firmly. "Yes, and it's quite serious. My daughter has been denied proper post-operative care, including scheduled pain medication. There are also allegations of discriminatory behavior from her assigned nurse." Dr. Hartman's expression grew concerned. "These are very serious claims. Why don't we speak in my office? It's just down the hall." "I don't want to leave Sarah alone for too long," Michael said. "Of course. We'll keep it brief, and I've already asked Dr. Patel to remain with your daughter in the meantime." Michael nodded his agreement, and they walked together to a small office near the nurse's station. Inside, Dr. Hartman closed the door and gestured to a chair across from her desk. "Before we begin," she said, taking her seat, "I want you to know that patient care and safety are our absolute priorities at Memorial. Any allegation of substandard care or discriminatory behavior is something we take extremely seriously." "I would hope so," Michael replied, his voice level but firm. "Because what I've witnessed this evening falls well below any acceptable standard of care, medically or ethically." "Please tell me exactly what happened," Dr. Hartman said, picking up a pen to take notes. Michael explained everything he had learned. Sarah's texts about being in pain and not receiving attention, the missed doses of pain medication, Nurse Winter's dismissive attitude about Sarah's discomfort, and finally, the statement from Thomas about the nurse's discriminatory comments. "This isn't just about a busy nurse forgetting a medication dose," Michael concluded. "The pattern suggests targeted neglect. My daughter was ignored while other patients received attention. Her pain was dismissed as exaggeration. And according to hospital staff, Nurse Winters made explicitly biased comments about her." Dr. Hartman's face had grown increasingly troubled as she listened and took notes. "I understand your concerns, Dr. Johnson, and they align with some previous incidents we've had with Nurse Winters. Nothing this explicit, but there have been complaints that we're investigating." "Previous incidents?" Michael repeated, his voice sharpening. "And yet she was assigned to pediatric post-operative care?" Dr. Hartman had the grace to look uncomfortable. "The complaints were still under review. Without conclusive evidence, there are protocols and union considerations." "With all due respect," Michael interrupted, "protocols and union considerations become secondary when patient safety is at risk. My daughter could have developed a serious infection or complications. The surgical site is showing signs of inflammation that went unmonitored for hours." "You're absolutely right," Dr. Hartman conceded, "and I assure you this will be addressed immediately. I'd like to speak with all the staff involved, including Thomas and Dr. Patel. In the meantime, Nurse Winters will be removed from your daughter's care immediately, and I'll assign our pediatric nursing supervisor to oversee Sarah personally." "That's a start," Michael acknowledged. "But I'm concerned about other patients as well. If Nurse Winters is capable of this kind of neglect with my daughter, what about children whose parents aren't medical professionals, who don't know what questions to ask or what care to expect?" Dr. Hartman nodded solemnly. "A valid concern. Nurse Winters will be suspended pending a full investigation, effective immediately. We'll review all her recent patient assignments and conduct interviews with staff who have worked alongside her." Michael leaned forward. "I want to be clear about something, Dr. Hartman. I'm not interested in creating a public relations nightmare for this hospital. What I care about is ensuring that my daughter and every other patient receives appropriate care, regardless of their race or background." "I understand completely," Dr. Hartman assured him, "and I share that goal. Would it help if I assembled our patient care team to go over Sarah's treatment plan with you? We can make any adjustments you feel are necessary." "Yes, I'd appreciate that," Michael agreed. "And I'd like to request that either Lucia or Melody be assigned to Sarah for the remainder of her stay. They've shown genuine concern for her welfare." "Consider it done," Dr. Hartman said, making a note. "Now, if you're comfortable with it, I'd like to speak with Sarah briefly, with you present. Of course, to apologize for her experience and assure her that she'll receive proper care going forward." "That would be appropriate," Michael said, standing. "But first I'd like to return to her room to make sure she's comfortable." They left the office together and walked back to Sarah's room. Inside, they found Dr. Patel checking Sarah's vital signs, while Lucia adjusted the window blinds to dim the harsh evening light. Sarah looked more comfortable than when Michael had left her, the pain medication finally taking effect. "How are you feeling, sweetheart?" Michael asked, returning to her bedside. "Better," Sarah said, offering a small smile. "The medicine is working. Dr. Patel says my fever is going down too." "That's good news," Michael said, squeezing her hand gently. Dr. Hartman stepped forward. "Hello, Sarah. My name is Dr. Hartman. I'm one of the hospital administrators." Sarah looked at her curiously. "Hello," she replied politely. "I wanted to personally apologize for the care you received earlier today," Dr. Hartman said, her tone sincere. "It wasn't up to our hospital standards, and it wasn't what you deserved as our patient. I promise that from now on, you'll have excellent care from our staff." Sarah glanced at her father, then back to Dr. Hartman. "Thank you," she said quietly. "Is Nurse Winters going to be my nurse again?" "No," Dr. Hartman assured her. "Melody will be your primary nurse for the rest of your stay, and Lucia will continue to help with your care as well." Relief washed over Sarah's face. "Okay, that's good." Dr. Patel cleared his throat. "Speaking of care plans, I've ordered some additional tests to make sure we're properly monitoring the inflammation at the incision site." "Nothing to worry about," he added quickly, seeing Sarah's concerned expression. "Just precautionary." "I'd like to review those orders," Michael said. "Of course," Dr. Patel replied, handing him the chart. While the doctors discussed Sarah's care, Dr. Hartman stepped back into the hallway. Through the partially open door, Michael could see her speaking with Melody and another woman he didn't recognize, likely the nursing supervisor she had mentioned. Outside in the corridor, raised voices suddenly drew everyone's attention. Nurse Winters had returned, now accompanied by an older man in a suit who appeared to be a union representative. "This is outrageous," they heard Nurse Winters say loudly. 20 years of service and I'm being suspended because of a complaint from one family. This is clearly an overreaction." "Lower your voice, Diane," the nursing supervisor warned. "This is a patient care area." "I have rights," Nurse Winters continued, though slightly quieter. "And I demand due process before any action is taken." Dr. Hartman stepped fully into the hallway, closing Sarah's door behind her to shield her from the commotion. Michael moved closer to his daughter protectively, but kept the door slightly ajar so he could hear what was happening. "Ms. Winters, you will have due process," Dr. Hartman was saying firmly. "But patient safety comes first. Multiple staff members have raised concerns about a pattern of care discrepancies, not just one family." "What staff?" Nurse Winters demanded. "That boy who stocks supplies. He's hardly qualified to evaluate nursing care." At that moment, Thomas rounded the corner with his supply cart. He froze when he saw the confrontation. Nurse Winters spotted him and pointed accusingly. You're trying to ruin my career with your lies." Thomas looked terrified but stood his ground. "I only reported what I heard, ma'am. Word for word. You misunderstood. I would never say such things about a patient." Nurse Winters insisted, her voice rising again. "Actually," came Lucia's quiet voice as she stepped out of Sarah's room, "Thomas isn't the only one who's heard you make those kinds of comments, Diane." All eyes turned to Lucia, who looked nervous but determined. "I've documented 3 separate instances where you made racially biased statements about patients," Lucia continued. "I reported them to management last month, and I've heard you specifically say that certain patients exaggerate pain to get medication, always patients of color." The union representative looked uncomfortable. He whispered something to Nurse Winters, who shook her head angrily. "This is a conspiracy," she hissed. "You're all against me because I uphold standards and don't coddle patients." "Withholding prescribed medication isn't upholding standards, Diane," Melody said, joining the group in the hallway. "It's neglect." Michael had heard enough. He gave Sarah's hand a reassuring squeeze. "I'll be right back, sweetheart," he promised. Before stepping into the corridor, the group fell silent as he emerged from the room. His presence, the calm, authoritative demeanor of a senior surgeon combined with the protective intensity of a father, changed the dynamic immediately. "Dr. Johnson," the union representative began, "I understand you have concerns about your daughter's care, but this isn't just about my daughter," Michael interrupted quietly. "This is about a pattern of discriminatory care that puts patients at risk. My daughter was fortunate. She could text me, and I have the medical knowledge to recognize a problem. What about the children who don't have those advantages? Nurse Winters opened her mouth to protest, but Michael continued. I've reviewed Sarah's chart. Pain medication was ordered for her every 4 hours, yet she received it only once in 8 hours. Her surgical site shows signs of inflammation that went unmonitored. These are objective facts, not matters of opinion. Patients often, Nurse Winters started. Patients often need advocates, Michael cut her off. And healthcare professionals have an ethical obligation to provide equal care to every patient, regardless of race, gender, or background. He turned to Dr. Hartman. I trust the hospital will conduct a thorough investigation and take appropriate action. We absolutely will, Dr. Hartman assured him. In fact, I'd like to invite you to participate in our patient advocacy committee. We've been working to improve our processes for addressing these very issues. The offer surprised Michael, but he nodded thoughtfully. I'd be interested in discussing that further once Sarah is recovered. The union representative tugged at Nurse Winters' arm. We should continue this discussion privately, he murmured. As they walked away, Michael caught Nurse Winters' final glare, a look of resentment mixed with something like shock that her behavior had finally caught up with her. Turning back to Sarah's room, he found his daughter looking anxious. She had obviously heard parts of the conversation. Everything's going to be okay now, he assured her, returning to her side. The hospital is making sure you'll get the best care. Was it because I'm black? Sarah asked quietly, her young face troubled by the realization. Is that why she didn't help me? Michael sat on the edge of the bed, considering how to answer this difficult question for his 12-year-old daughter. He believed in being honest with his children, but also in being age-appropriate. It seems like Nurse Winters has some biased beliefs that affected how she treated certain patients, including you, he said carefully. But that's about her problems, not about you. You did nothing wrong in asking for help when you needed it. But why would she think that way? Sarah persisted, trying to understand. Michael took a deep breath, considering how to explain such a complex issue to his daughter. This wasn't how he'd planned to have this conversation with Sarah, but the moment demanded honesty. Some people grow up learning wrong ideas about others who look different from them, he explained gently. They start believing these ideas without questioning them. Nurse Winters probably heard these wrong ideas about pain tolerance and how people of different races experience pain. Those ideas aren't based on medical science or truth, they're based on old prejudices. Sarah frowned, taking this in. But she's a nurse. Shouldn't she know better? She absolutely should, Michael agreed. Healthcare professionals are taught that pain is what the patient says it is. We're supposed to believe our patients and treat their symptoms accordingly. What she did goes against proper medical training and basic human decency. Has this happened to you too? Sarah asked, her eyes wide with the new realization that her father might have faced similar treatment. Michael nodded slowly. Yes, in different ways. There have been times when patients assumed I was an orderly or a technician, rather than their surgeon. Times when colleagues questioned my qualifications despite my training and experience. It happens, but I've never let it stop me from doing my job or being who I am. Sarah looked down at her hands. It doesn't seem fair. It's not, Michael said simply. But what happened today is important for another reason. Did you notice how many people stood up when they saw something wrong? Lucia, Melody, Thomas, Dr. Patel. They all recognized the unfair treatment and did something about it. That's how change happens. This perspective seemed to comfort Sarah. She looked up at her father with renewed interest. They did stand up, didn't they? Even Thomas, and he seemed scared. That takes real courage, Michael confirmed. Speaking up when you see someone being mistreated is one of the bravest things a person can do. Their conversation was interrupted by a gentle knock at the door. Melody entered, carrying a tray with fresh juice and a small bowl of soup. Sorry to interrupt, she said with a warm smile. But I thought Sarah might be ready to try eating something more substantial now that her pain is better managed. That sounds like a good idea, Michael agreed, looking at his daughter. Feeling up to it, sweetheart? Sarah nodded, realizing she actually felt hungry for the first time since her surgery. Yes, please. Melody set up the tray and adjusted Sarah's bed so she could eat comfortably. The kitchen is officially closed for the night, but I convinced them to heat up some chicken soup. Much better than that Jell-O they sent earlier. Thank you, Sarah said, genuinely appreciative. Dr. Hartman asked me to let you know that the situation is being handled, Melody added, speaking to Michael while Sarah began to eat. Nurse Winters has been escorted from the building. Her suspension is effective immediately, pending a full review. Michael nodded. That's appropriate. I appreciate the swift response. It's been a long time coming, Melody admitted quietly. Many of us have had concerns. Why hasn't anyone spoken up before? Michael asked, keeping his voice low. Melody sighed. Some did, but it's complicated. Diane has seniority and connections with administration. Previous complaints were dismissed as personality conflicts or communication issues. But this time was different. Too many witnesses. Too serious a lapse in care. And my position probably didn't hurt, Michael acknowledged, understanding how the system often worked. A complaint from a surgeon carried more weight than one from a patient without medical connections. Your daughter deserved better care regardless of who her father is, Melody said firmly. Every patient does. I'm just glad you were here to advocate for her. Michael glanced at Sarah, who was focused on her soup. So am I. Later that evening, after Sarah had finished eating and settled back to watch some TV, Lisa called to check in. Michael stepped into the hallway to update his wife on everything that had happened. I should come right now, Lisa said, her voice tight with concern when Michael explained the situation. The twins are probably already asleep, Michael reasoned. Sarah is comfortable now and I'm staying overnight. Why don't you come first thing in the morning? Bring some of her things from home, her favorite pajamas, her tablet, maybe that book she's been reading. Lisa agreed reluctantly. How is she handling all this? Like a champion, Michael said with pride. She's resilient, Lisa. And this has sparked some important conversations about bias and standing up for what's right. I think she's learning some powerful lessons through a difficult experience. After finishing his call with Lisa, Michael returned to find Sarah watching a nature documentary, her eyelids growing heavy as the medication and the long, stressful day took their toll. Mom's coming in the morning with your stuff, he told her, settling into the chair beside her bed. She's bringing your blue pajamas and your tablet. That'll be nice, Sarah murmured sleepily. Dr. Patel stopped by once more before ending his shift, checking Sarah's temperature and examining the incision site again. The inflammation looks a bit better already, he reported with satisfaction. The antibiotics we added should help prevent any infection from developing, and her fever is down to 99.9. Thank you for your attention to her care, Michael said sincerely. Dr. Patel nodded. I'm just doing my job, which is what every patient deserves. He turned to Sarah. You get some rest now. I'll see you on rounds tomorrow morning. As the night deepened, the hospital grew quieter. The lights in the corridor dimmed, and the overhead page system called out only occasionally in hushed tones. Melody checked in every hour as promised, her presence reassuring and unobtrusive. Sarah drifted in and out of sleep, each time opening her eyes to find her father still there, sometimes reading hospital journals on his phone, sometimes just watching over her. The pain medication kept her comfortable, and the knowledge that she was being properly cared for allowed her to truly rest. Dad, she said drowsily during one of her wakeful moments, you don't have to stay up all night. I'm feeling better now, Michael smiled. I know you are. But I want to be here. You have surgeries tomorrow? I rescheduled them, he told her. You're my priority right now. Sarah's eyes grew heavy again. Love you, Dad, she mumbled as sleep reclaimed her. Love you too, sweetheart, Michael whispered. Morning arrived with the gentle bustle of shift change. New nurses introduced themselves, checking vitals and changing IV bags. Sarah woke feeling significantly better. The pain was more manageable, and her temperature had returned to normal. Dr. Hartman stopped by early, accompanied by an older gentleman in an expensive suit. Good morning. Dr. Johnson, Sarah, she greeted them. This is Mr. Reynolds, our hospital board chairman. He wanted to speak with you personally. Mr. Reynolds stepped forward, his manner grave but kind. Dr. Johnson, on behalf of Memorial Hospital, I want to express our deepest apologies for what your daughter experienced. It falls far below our standards and values. Michael stood to shake the man's hand. I appreciate that, Mr. Reynolds. We've initiated a comprehensive review of our policies and reporting structures for bias incidents, the chairman continued. And I understand Dr. Hartman has invited you to participate in our patient advocacy committee. I want to personally second that invitation. Your perspective as both a medical professional and a parent would be invaluable. The conversation continued, with Mr. Reynolds asking thoughtful questions about Michael's experiences as a Black physician and what improvements he would suggest for the hospital's approach to equitable care. It was clear the hospital leadership was taking the incident seriously. After they left, Lisa arrived with a bag full of Sarah's things and fresh muffins from their favorite bakery. The family reunion was warm, with the twins joining via video call to make funny faces and show Sarah the get well cards they'd made. By afternoon, Dr. Patel had good news. The incision is healing properly now and all your labs look good. If things continue this way, you should be able to go home tomorrow morning. Really? Sarah perked up considerably at this news. Really? The doctor confirmed with a smile. You'll need to take it easy for a couple of weeks, but you're making excellent progress. As Dr. Patel left, Thomas appeared at the door with fresh water pitchers for the rooms on the floor. He seemed hesitant to enter. Come on in, Michael encouraged him. Thomas stepped inside, placing the water pitcher on the bedside table. I just wanted to see how you're doing, he said to Sarah. Much better, thank you, she replied. My dad says you helped make sure I got proper care. That was really brave. Thomas blushed slightly. I just did what was right. Nobody should be treated differently because of how they look. Well, it made a big difference for me, Sarah told him sincerely. After Thomas left, Sarah turned thoughtfully to her parents. I've been thinking about something. What's that, honey? Lisa asked. When I grow up, I want to be a doctor like Dad, Sarah said with newfound determination. I want to help make sure everyone gets good care no matter what. Michael and Lisa exchanged proud glances. That's a wonderful goal, Michael said. And I have no doubt you can achieve it if that's what you decide to do. 6 months later, Sarah stood beside her father at the front of a large lecture hall filled with medical students, residents, and hospital staff. Her surgical scar had healed to a faint line barely visible beneath her shirt. Her confidence, however, had grown immensely. Memorial Hospital had invited them to speak at the inaugural session of their new healthcare equity training program, a direct result of the incident and the subsequent investigation, which had uncovered other cases of biased care. I'd like to introduce my daughter, Sarah, Michael said to the audience after completing his portion of the presentation. She's the reason we're all here today, and she has something important to share with you. Sarah stepped up to the microphone, nervous but determined. She looked out at the sea of faces, future doctors, nurses, and healthcare professionals who would one day hold patients' well-being in their hands. 6 months ago, I was a patient in this hospital, she began, her voice growing stronger with each word. What happened to me was wrong, but something good came from it. I learned that speaking up matters. I learned that one person standing against unfairness can make a difference. And most importantly, I learned that change is possible when people work together to make things right. As Sarah continued her story, Thomas sat in the back row, now wearing the uniform of a patient care assistant. The hospital had offered to pay for his training after recognizing his integrity. Lucia and Melody were there too, having been promoted to leadership positions in the hospital's new equity initiative. And in the front row, Dr. Hartman nodded encouragingly as Sarah described the changes the hospital had implemented. Anonymous reporting systems for bias incidents, regular training for all staff, and a patient advocacy program specifically designed to support vulnerable populations. My experience was painful, Sarah concluded, but it led to positive change. That's what karma really means, not just bad people getting punished, but good coming from difficult situations. Every patient deserves equal care and respect, and sometimes it takes brave people speaking up to make that happen. As applause filled the lecture hall, Michael put his arm around his daughter's shoulders, filled with pride. The incident had been a harsh lesson for Sarah about the realities of bias, but it had also shown her the power of advocacy and the possibility of progress. And that perhaps was the greatest karma of all, turning a moment of injustice into a movement for change.